Selection of natural birth instead of cesarean section by Javier Andrés Arroyo Morales and Gabriela Nicole Matos Ortiz. Cesarean section. What does it mean? A cesarean section is a surgery in which a doctor helps the mother to deliver her baby through incisions in her abdomen and uterus, which is way different than a natural birth. A natural birth is the moment where the woman delivers her baby through her vagina.
Advantages of getting a cesarean section. A cesarean section is supposed to be done to a mother whose baby has a high risk of dying or being harmed at the time of his or her birth, either because the baby is not in the correct position, the umbilical cord is surrounding the baby's neck, or if the mother suffers of any conditions that may complicate the conception process. If it is implemented because of any of these reasons, its obvious benefit is to protect the life and health of the little one. As other advantages, we can mention the capacity of choosing the date of the delivery, because a C-section does not have to wait for contractions to start. This means that it can be done by just picking a date. Women who are afraid of giving birth naturally because of the immense pain that it is involved in the process often consider the reduced pain because of the use of anesthesia at the moment of the delivery as an advantage of this invasive procedure. Also, through a C-section some injuries can be prevented, such as the breaking of the woman's perineum, which is the area between the anus and the vulva. Finally, with C-section, the time of the procedure is constant and relatively short. On the other hand, the C-section has some disadvantages that everyone should be very aware of. For example, the baby does not obtain the microorganisms from the mother's vagina, which are important for a healthy development and prevention of future conditions. In addition, the mother gets exposed to post-surgical implications and risks such as delivery time, abdominal pain, getting the wound infected, and any other risks that are given by every invasive procedure, such as an hemorrhage or any other complication during the surgery, risking the mother and the baby to a tragic ending. Finally, we can mention that in most cases, women that go through C-section are conditioned to deliver their next babies through a C-section too, because for a mother who had a previous C-section, natural birth can cause the detachment of the uterus and a dangerous internal bleeding in the body of the mother. This means that a C-section, besides the effects that it has in the health of the baby, makes the mother dependent of it every time that life gives her the opportunity of having a son or a daughter. All these reasons make clear why all women should consider that a C-section not only affects the present, but also her future and the development of all their future children.
Natural birth. When neither the woman nor her baby have high risks at the moment of giving birth, it should always be naturally. During natural birth, women have the opportunity of feeling some sensations that they would never feel if they have a C-section instead. The presence of the family is very important for the woman to feel comfortable and confident, and that could only happen when conceiving the baby naturally. Also, during the natural birth, the woman's body secretes certain hormones which, after the baby is received, lead to a stronger mother-baby relationship. Finally, an important advantage of this birth method is that the baby acquires some microorganisms from the mother's vagina that prevents the baby from suffering several conditions, such as asthma, allergies, and autoimmune problems. Besides, A disadvantage that natural birth can entail is that the woman and the baby could suffer bad consequences if it is a high-risk pregnancy, because both are more vulnerable to any eventuality.
During the month of April 2017, we performed a survey that consisted on studying the type of delivery procedures performed in women from the west side of Puerto Rico from 1965 to 2008. We were able to ask questions to 75 women in total, out of which 50 gave birth via C-section, while 25 gave birth naturally. The following chart presents the results obtained in the survey. On 1965, 2 of the participating women gave birth through Cesarean section, while none gave birth through natural birth. On 1967, 4 were C-section and 1 of natural birth. 1971, 3 C-sections and 5 natural births. 1973, 1 C-section and 1 natural birth. 1974, 1 natural birth and none C-sections. 1975, 3 C-sections and 2 natural births. On 1977, 2 C-sections and none natural births. 1985, 1 C-section, any natural birth. 1990, 3 C-sections and 1 natural birth. 1994, 2 C-sections and 1 natural birth. 1995, 0 C-sections and 1 natural birth. 1996, 6 C-sections and 2 natural births. In 1997 were the most C-sections made of the women who participated on the survey. There were 19 C-sections and 8 natural births. In 2000, 1 C-section and none natural births. In 2008, 3 C-sections and 2 natural births. The following chart was taken out of a paper published in 2010 by Faye Maneker and Brady Hamilton about birth in United States. On this chart, we can see that in 2007, 32% of the babies were welcomed to life by C-section. In accordance to the statistics presented before, we can notice that with the pass of the years, the number of natural births has been reduced as the number of C-section increases. This is a matter of concern because it means that we are leaving aside our natural instincts. We are forgetting about the unique experience that it is to bring your child to life and be present consciously to enjoy it. The worst of the case is that this is happening indirectly against the will of our women, who are not receiving all the options they have for each specific situation.
Social impact. What is happening in our society? What we are trying to express in this presentation is that women in our society are being indirectly forced by doctors to undergo cesarean section instead of having birth naturally. People may think that this argument does not make sense because there's no reason for a doctor to give surgery to someone just for personal whim, but in fact there really are reasons. Having the C-section as an option is a benefit for the doctors because they have the chance of scheduling it to a specific day, it is not going to take them by surprise like the natural birth, and they receive more money, and they do not have to stay for hours at the hospital with the woman trying to deliver her baby while crying and yelling. As a consequence of these benefits, the doctors take advantage of their title and take the women to think that what they recommend is the better option for them and for their babies, while the truth is that they are only looking after their own interests and their comfort. They sometimes classify the woman as high risk and say they need a cesarean section because they could die during a natural birth. Sometimes they see in the sonogram that the baby is not in a good position and recommend a C-section. Sometimes they just don't give the mother any other option, and they do not inform the woman correctly about the real consequences for them and for their babies. The point is that their title makes them trustworthy, and that's what takes the woman and the rest of the family to believe in them. And there comes the scam. A C-section is done, and we receive it to life a baby very prone to health conditions, and a mother with an unnecessary wound in her abdomen and all the implications that it could bring. Our thinking is strengthened by the two documentaries, The Business of Being Born by Ricky Lake and Orgasmic Birth by Deborah Pascali Bonaro. They both talk about how doctors, with the pass of the years, have been treating birth as any person would treat any type of business. Their main idea is to try to gain more money by having the easiest schedule. The hospitals are also a business, so its administration will always prefer to welcome patients that will need to spend more money, which in this case are the women that may need C-section. Then, the hospital administration is another factor that the doctors consider at the time of serving a pregnant woman. The documentaries also talk about the home birth and try to convince people that it should always be the better option of where to give birth. Both documentaries mention some benefits of the home birth. For example, they mention that the woman's home is the only place where she could feel comfortable between family, in a peaceful, quiet place with less illumination than a hospital room. In brief, a place where the mother can enjoy and feel the experience to the fullest. And if they are lucky, they could also experiment an orgasm during the moment of the birth. They also argue that the woman secretes certain hormones at the moment of birth that remain in the body, contributing to a better mother-baby relationship when the mother holds the baby right after being born, an act that could only be reached in the house and not in the hospital. Finally, they mention that in the hospital the exposure to all the technology, medicines, and contagious diseases can affect both the mother and the baby very significantly, and this could only be prevented by having a home birth. We also include as a reference the following two papers: Ethical Issues Relating to Childbirth as Experienced by the Birthing Woman and Midwife, and Home Birth, Consumer Choice and Restriction of Physician Autonomy. The papers talk about how the doctors have started to take control of the conception, as if it is a medical issue, an idea that is completely wrong because bringing someone to life is not even close to having a health condition. That's why the authors argue that giving birth should be an intimate moment between the mother, the father, and the new little one. The doctors are also convincing women to go to the hospital and, in most cases, experiment C-section using safety as an excuse. This argument is invalid because the hospital also put women at risk, and anyways, if people only think about safety, they would never do anything, because we are constantly taking risks at life. Safety shouldn't be the first thing to consider when thinking of the delivery of our babies. Because of this reason, Paul Thompson argues that people should restrict, in one way or another, the doctor's autonomy in our women's decisions of how, when, and where to deliver their babies, so that our society doesn't lose the beauty of the act of giving birth naturally. How can each one contribute?
Pregnant women are the ones who have the last word. So, you, future mom, you need to prepare yourself before making this important decision in your life. Start by studying the pros and cons that each birth method has. Then, having all the information gathered, you should be able to know that by choosing a C-section you may be exposing yourself and the life of your baby at the moment of the birth and in the future, while by giving birth naturally, your risks are highly decreased, as long as both the mother and the baby meet the necessary conditions for a successful natural birth, such as good health state, correct position of the baby in the womb, etc. In short, that the pregnancy was fully successful. In conclusion, every woman that gets well informed in advance will be able to consider all the chances and choose what will be best for both. Finally, don't get carried away by other women's experiences and anecdotes. No one will have the same experience, so live your own. Make your own choice according to yours and the baby's needs. We also think that doctors can highly contribute to this problem, since they are the ones who inform and influence the woman. First, put yourself in the shoes of others. Don't get carried away by ambition. Practice the previously learned moral values. Be that doctor, the one that you would like your family to have. Also, inform your patients in advance. You should give the mother the more options as possible and explain each one in a clear way, letting her choose what is best for the welfare of both. And finally, by showing confidence in your statements, the woman will feel safer in your hands. So, please don't let her down. Personal approach. Natural birth is the most beautiful experience a woman can experiment, and with the pass of time we had lost that perspective. The doctors often encourage women to give birth at the hospital by not giving them all the information regarding home birth, not explaining them the risks that they will face at the hospital, or by promoting fear, classifying them as low or high risk women. Most of the people are not familiarized with this social issue, but this is really affecting our women and our new generations. This is why we want to seize this opportunity to contribute by raising awareness and demonstrating the community that home birth should be hardly considered by all pregnant women.
Selection of C-section instead of natural birth is a mistake when it is not under crucial circumstances. Everyone should know the short and long-term consequences that fall under this important decision of life. Hopefully, this video will create awareness in everyone, especially in all young women who are on reproductive stage of life, because we need to put an end to this social disturbance. Our doctors should be more honest and concerned with their patients for the future of our species. The ambition of some results in the loss of others, and for this reason we should be more concerned and think about the consequences that some actions have. Let's start the change by thinking in those problems that are not so well known by people, so we can make a difference.